Carpal tunnel syndrome or CTS is a medical condition that occurs when the median nerve, which runs from the forearm to the hand through a narrow passage called carpal tunnel, becomes compressed or squeezed at the wrist. The carpal tunnel is a narrow passageway located on the palm side of the wrist. It is made up of bones and ligaments, and it protects the median nerve and the tendons that control the fingers. Common causes of carpal tunnel syndrome include repetitive hand motions such as typing or assembly line work, as well as wrist injuries, obesity, pregnancy, and certain medical conditions like diabetes and rheumatoid arthritis. The treatment option for carpal tunnel syndrome includes splinting, medication, physical therapy, and in severe cases, surgery. So your patient may present with numbness, tingling, and pain in lateral 3.5 fingers, nighttime symptoms that awake the patient relieves the symptom by shaking the hand or wrist. It can be unilateral or bilateral. Weakness or clumsiness can be present. Hand functions such as loss of grip and dropping things are the common symptoms. Autonomic symptoms like tight, swollen feeling of fingers, hands, temperature changes, hot or cold feeling in the hands, and changes in sweating can also be present. If patient complains of pain or weakness in the hands, then ask, when did your pain or weakness started exactly? Is it gradually increasing or decreasing or remaining same? Is it more in the morning? Is there anything which aggravates the pain or weakness? Is there anything which relieves it? Then take brief medical history from the patient. If he or she has diabetes, rheumatoid arthritis, any thyroid problem, obesity, etc., because as mentioned earlier, these are the causes of carpal tunnel syndrome. You can also check the patient's feet for pitting edema, because kidney problems can also cause carpal tunnel syndrome. If the patient is female, don't forget to ask about pregnancy. If you forget it, then you'd lose a lot of mark, because pregnancy is a very important cause of carpal tunnel syndrome. Also look at patient's face to identify if there is any changes due to acromegaly, because acromegaly is also an important cause of carpal tunnel syndrome. Examine the patient's wrists. At first, inspect the wrist for any obvious swelling, tenderness, any muscle atrophy, especially over the thinner eminence. Then check the strength of hand muscles. Check the range of movement of the wrist. Then perform Tinel sign test. This involves tapping on the median nerve at the wrist to see if it causes tingling or numbness in the hand. Also do Phalen's test. This involves flexing wrist for 60 seconds to see if it causes any pain. Then explain the condition to the patient. I think you have a condition named carpal tunnel syndrome. It happens when a nerve called median nerve gets compressed in your wrist, and that's why you are having weakness of your hand muscles and also some pain in your hand. I would refer you to our multidisciplinary team, which includes a nerve doctor, a bone doctor, physiotherapist, and other professionals. We might need to do further tests to confirm the diagnosis, and finally we can treat your condition with splints for 4 weeks, or for some cases steroid injections or minor surgery is required. If you would like to know more about surgical treatment options, then I would refer you to our joint doctor. The examiners can ask you, how would you diagnose a carpal tunnel syndrome? Start your answer with history taking, physical examination, then diagnostic tests like electromyography or nerve conduction study can formally diagnose median nerve conduction problems. And finally, imaging tests also have some role like ultrasonography and MRI of wrist joint to visualize the structures of the wrist and to rule out other conditions. The examiners can also ask you about amyloidosis because it is a cause of carpal tunnel syndrome. So your answer can be amyloidosis is a rare disease in which an abnormal protein called amyloid builds up in the body's organs and tissues, leading to damage and dysfunction. Amyloid is an insoluble fibrous protein that can deposit in various parts of the body, including the heart, kidneys, liver, nervous system, and digestive system. There are several types of amyloidosis, and the symptoms and progression of the disease can vary depending on the type and location of the amyloid deposits. Some common symptoms of amyloidosis include fatigue, shortness of breath, weight loss, swollen ankles and legs, enlarged tongue, irregular heartbeats, and neuropathy.